Hi everyone, this is Group 2's presentation on dietary fat and breast cancer. Dietary fat recommendations seem to be contradictory, leaving many people confused or overwhelmed. As research continues, recommendations evolve, but turning these research findings into recommendations is challenging. First, we will give a background of the link between dietary fat and breast cancer before evaluating the strength of the epidemiological evidence available and how this research has impacted policy. One noteworthy study by Armstrong and Dahl created widespread attention after finding correlations worldwide between fat consumption and breast cancer incidence. They cautioned that their findings may have reflected other variables such as economic development and food waste. However, the association between dietary fat and breast cancer remained, and further studies were justified. To illustrate the conflicting results around this topic, Willett compared the highest fat intake quintiles with the lowest quintiles and found no positive association. Additionally, an article published by Willett in 2001 suggests that a low-fat, high-carbohydrate diet may increase breast cancer risk for some women. In the following research findings, it's evident that the link between diet and disease is hard to determine for many reasons. Research on this relationship has been ongoing for about 60 years when publications came out showing a striking correlation between fat consumption and breast cancer rates. There are overall concerns with this relationship, though. Some of these concerns include animal studies, correlational data from population studies, retrospective and prospective studies on individuals, null-finding inferences, and randomized trial difficulties. The following slides highlight some research explained in nutritional epidemiology by Walter Willett. Strong correlation between national per capita total fat and breast cancer rates is associated with animal fat. Association is confounded by factors such as lean body mass, obesity, sedentary lifestyle, reproduction, and economic development. High incidences tend to occur in westernized countries. Specifically, high total dietary fat intake and high female breast cancer mortality rates are found in countries including Germany, Sweden, Australia, Ireland, Switzerland, New Zealand, the UK, the Netherlands, and Denmark. Problem with this data is that it overestimates how many calories a day individuals are eating, thus creating more of a correlation between food wastage and breast cancer risk. In 1978, Miller and colleagues compared diets of 400 Canadian women with breast cancer with those of 400 neighborhood controls. Methods for data collection included the 24-hour recall, 4-day dietary record, and dietary history questionnaire. The only statistically significant results were for data based on the 24-hour recall, but researchers think it's unreliable and biased. They found the same percentage of total calories from fat and saturated fat from both groups. Meta-analysis of 49 case control studies additionally did not report a significant relation, but reported a positive association. These carry less weight than ones from prospective studies because of recall and selection bias. Willett suggests that migrant studies can provide insight on the rates of breast cancer, which illustrates that genetics does not always play a role in developing breast cancer, but also the environment. One study discovered that Japanese immigrants did not develop breast cancer at the same rates of the American population. Interestingly, the offsprings of those immigrants had incidences of breast cancer identical to the American population. In contrast, Polish immigrants that came to the United Kingdom and the United States had similar occurrences of breast cancer. Willett notes the importance of studies examining the relationship between dietary fat in childhood and the impact of breast cancer later in life. The Age, Gene, Environment, Susceptibility Reykjavik cohort study examined about 3,000 women's meat intake, including salted and smoked meat and fish, as well as milk and whole grains during adolescence and midlife in relation to the risk of breast cancer. The women completed a food frequency questionnaire based during enrollment between the ages of 14 to 19 and later between the ages of 40 to 50. The food frequency questionnaires were based on the top 10 and 11 foods consumed. A correlation was not observed with the intake of meat and milk during adolescence or midlife. The researchers did find a slight association with women who consumed smoked or salted meat more than once a week compared to women who consumed it less than 3 times a month during midlife. It's necessary for research studies to evaluate early dietary patterns to determine if there's a connection with breast cancer. However, documenting a child's diet is difficult from ages 1 to 10. In the future, collecting more data on childhood diets could help determine if there's a link between breast cancer later in life. Some animal studies have found that different types of fats are associated with breast cancer. According to Willett, a few animal studies have found that polyunsaturated fat may increase the risk of breast cancer and mammary tumors, while others have not found a correlation. A study by Smith-Warner in 2001 found that polyunsaturated fats did not increase the risk of breast cancer. Results in animal studies remain inconsistent. Despite mixed results on the associations between dietary fat and breast cancer, the most significant movement to date involving the belief of the relationship between dietary fat and cancer development, particularly breast cancer, was through the National Research Council in 1982 to set a recommendation for lowering dietary fat to 30% of dietary intake. During this time, the National Cancer Institute also saw research as ever-changing and recommended reviewing dietary guidelines every 5 years, which continues to have both its strengths and limitations. As institutions that focused on the prevention of specific diseases and align with research previously described in this presentation, the National Cancer Institute and the American Cancer Society recognize that research does not necessarily support that lowering fat intake has an effect on the risk for breast cancer. The American Cancer Society has set guidelines or recommendations for the prevention of breast cancer and acknowledges that increased body weight and weight gain during adulthood, radiation exposure, and menopausal hormone therapy present a higher risk for developing breast cancer. Current recommendations provided by the American Cancer Society include regular intentional physical activity, avoiding weight gain through lower caloric intake, and limiting or avoiding alcohol intake.